I know that your partnership with the Kenyan government has been really important to your work as far as committing to global targets, but also, access to data. But I know that hasn't always translated on the ground as far as data on maternal health, primary care. So I'm wondering how the Kenyan government can kind of set the example for others as far as data accessibility.
I think the Kenyan government has been actually one of the few African countries with a strong national commitment to open data portals. But one thing is to have an open data policy and a portal. The other is to populate it with data and with that people can easily have access to and use. So the challenge we've seen in Kenya is similar to what we have in other countries. There is the political commitment, but it's really lack of coordination in being able to get those data and enforcement of those policies. The fundamental core data systems that are needed at country level, which are really the routine data, are often neglected, and that is where the challenge is. Such data do exist, but they exist on paper in facilities across the whole country. And when you tell somebody to give you a summary of that, they can just give you any estimates. You can't trace that data back to the facility and get exactly what you're measuring. But there are innovations that could transform that data and make it more available.
How does APHRC do that? How are you setting the example as far as making sure that policymakers or whoever actually needs to be using this data is getting it in the form that they need in order to really utilize it?
Most of our work really on data systems, we've worked with national statistical offices in the region and regional leaders to really look at some of those constraints and how to get around them. We've created what we call country compacts, which really can be a roadmap for countries to look at how best to put in place a system that allows for at least for a dialogue to start with on what the policy environment should be that should govern data, what the investment strategy should be, where you can have more national level investment in data systems, and how different ministries and agencies could work together to actually drive this.
And I know that you spent your career being really supportive of, collecting data in Africa by Africans, by African scientists. And you've been really supportive, I think, of growing that community of African scientists. How have things changed even since you began your career, I guess, one? And two, what do you see as the future for up-and-coming African scientists?
So what has changed? We've seen a lot of people, with the 340-something people we have supported over the years, they've produced hundreds of papers and attracted millions of dollars in research grants supporting their own work in their own institutions. To me, that is something to have a second-year doctoral student win a $625,000 R01 grant from NIH is what I want to see more and more of, where people are taking the initiative and providing the leadership in their research. But more importantly, they are able to communicate the same to the people they are mentoring, who are the people coming next after them. So what we've seen through two major initiatives we run, the African Doctoral Dissertation Research Fellowship and the Consortium for Advanced Research Training in Africa, we are changing the motivation and the commitment of young Africans who now believe they can actually do good science that can be published in the best journals. They can compete for global research grants and be able to win them and stay in Africa doing research. So to me, that is an interesting place to be, to see that development around the region.